Lisa Furst, the Chief Program Officer at Vibrant Emotional Health, and I am honored to welcome you all to the second day of today's Symposium, Bridging the Gap, which is focused on disaster behavioral health access for all. Today's presentations will continue the conversations that we started on our first day, and I know that all of you are eager to dive into today's events. But before we get started, I'd like to take a moment to reflect on what we learned yesterday. We had a keynote address focused on how technology can be used to promote equity and provide communities access to care. We learned about different methods and practices for providing care for children and adolescents who have experienced disasters, whether it's from losing loved ones to COVID-19 or to natural disaster. We discussed best practices for using forensic psychology to help refugees and asylum seekers. We reviewed tools and techniques developed from field experience, the methods and best practices for providing on-the-ground care to new refugees coming into the country. We also heard about how a state's public health department can set up robust, varied, and accessible spiritual and crisis counseling care to communities following disasters. The content we engaged in yesterday focused on providing high-quality, accessible disaster behavioral health support to all, not only reflects the ongoing focus of the crisis emotional care team, but also reflects the core values that underlie all of Vibrant Emotional Health's programs and services. Some of the key examples of Vibrant's commitment to supporting emotional well-being for all include working with crisis centers around the country to build increased access to crisis support and community programs with the upcoming 988 system, the Disaster Distress Helpline's partnership with Deaf Lead to provide disaster behavioral health support to individuals in the deaf and hard of hearing communities, embedding peer supports wherever possible in our programs, including in our family and youth support programs locally in New York City, as well as in NYC Well, the 24/7 mental health and emotional support hotline in New York City, and engaging in advocacy to encourage the development of robust public policy that effectively removes barriers to community-based care and promotes access, connection, and well-being for all. And now for a quick look at today's events. We are going to hear a keynote address from the Director of Domestic Funds at the Center for Disaster Philanthropy, a funder of our crisis emotional care team for whom we are eternally grateful. We are going to learn more about how to be culturally inclusive in planning for and setting up disaster care management. We will discover a new method of thinking about the psychological effect of co-occurring disasters and take a look at the different ways trauma can present in our current moment. We're in a moment in history unlike others, and that discussion will be happening today. And we are also going to explore methods to help build resilience and capacity in youth who experience disasters. I also want to remind everybody that today is not only about learning together, which it certainly is, but it's also about making and strengthening our connections with each other. We'll be gathering at our break at 1 p.m. and we'll be gathering again for a happy hour starting at 4 in Gather Town. And there's a link that has been and will be provided to you. And Gather is a virtual space where we can chat together, where we can lounge, to just take a breather. There's an opportunity to play some games and more. It's through fostering our connections and relationships with each other that we do the work that we do and that we support our communities best. So we wanted to make sure that we included that throughout your symposium experience over the last 2 days. And I want to also encourage folks to consider, if you haven't already, getting engaged with our crisis emotional care team and joining our national cadre of support professionals. Our mission is to provide quality support to those affected by disasters, and we can't do that without continually growing our capacity to serve. And in order to grow, we need you. We would love to have you get involved. We are always looking to increase our numbers around the country. And so if you are interested in learning more about our program and joining our cadre, please reach out to our team. We'd be delighted to talk with you, to explain how it works and to discover with you ways that you can get involved. Finally, I would like to thank our presentation selection committee, Dr. Andy McLean, Dr. Linda Paradiso, and Pat Lincourt. We are deeply grateful for their partnership, support, and expertise. Planning an event that is happening today and that happened yesterday, a symposium like this does not happen on its own. It really does take a village, and we are so grateful that our village includes these incredible folks who have joined us in this effort. I want to wish everybody a wonderful day today. I hope you learn, grow, get excited, get engaged, ask questions, and connect with each other. And with that, I am going to turn it over to our terrific program director of our crisis emotional care team, Amy Dominguez. Amy, take it away.
Hi, everybody. Thank you so much for joining us today. I'm so grateful for you and for you taking out the time to be here. And thank you so much, Lisa, for your comments and getting us started on the right foot. Before I introduce our keynote speaker this morning, Sally Ray from the Center for Disaster Philanthropy, I want to start this in a similar fashion that we started yesterday with a box breathing exercise. This just helps us take a moment. This has been a long week for many of us. A lot of things going on. Maybe we've been traveling to different places. We have different stressors. And I think it is important before we enter into a space to receive more information that we just take a moment to breathe. So yesterday we did a box of 3. We're inhale for 3, exhale for 3. We're going to do 4 today. And I'm going to ask that you hold your breath for 3 seconds when you inhale and before you exhale. So close your eyes. Figure out where your feet are on the floor, or if they're up. Relax your shoulders, maybe relax your jaw a little bit. Just be mindful of the things that are ahead for you today. Maybe you have an exciting thing this weekend with family, or just a relaxing time. Focus on something that gives you joy, and then let's breathe together. So we'll inhale on my count. 1, 2, 3, 4. Hold it for 2 seconds and exhale. 1, 2, 3, 4. Inhale again. 1, 2, 3, 4. Hold it for 1, 2. Exhale. 1, 2, 3, 4. One more time. Inhale. 1, 2, 3, 4. Hold it for 2 seconds. Exhale. 1, 2, 3, 4. Okay. I don't know about you, but that makes me feel a whole lot better to start today. And I'm going to actually bring in our keynote speaker this morning. So Sally Ray has an incredible bio to go from. She is the Director of Domestic Funds for the Center of Disaster Philanthropy. She has nearly 30 years of experience working in the nonprofit world and has a specific passion for community and social service. And she brings that to her current role, but also previously as the Director of Strategic Initiatives and the Director of Hurricane Harvey Recovery Fund at CDP. In her current role, Sally oversees grant making for several domestic disaster funds, including the CDP Atlantic Hurricane Season Fund, the CDP California Wildfires Recovery Fund, the CDP Colorado Wildfires Recovery Fund, the CDP Disaster Recovery Fund, and the U.S. grant making for the CDP COVID-19 Response Fund. She is a sought-after speaker on strategic topics of long-term recovery funding and support for trauma-informed care after disaster, funding grassroots organizations to build community resilience, and supporting organizational and community capacity for recovery after a disaster. She's been a speaker for the National Voluntary Organizations Active in Disaster, VOAD, as we more commonly know it, the Federal Emergency Management Association, or FEMA, and local, state, and regional disaster-related conferences and training. She currently lives in Cypress, Texas with her husband, Bill, and their 10-year-old pup, Boone, who frequently appears to say hello on Zoom meetings. Maybe we'll get a little bit of a view today. She and Bill have 2 adult sons, Michael and Steven, and she's an avid sports fan and has a particular passion for the Astros in Houston, the Oklahoma City Thunder, and all athletic teams of Oklahoma State University, her alma mater. So with that, I'm excited to present Sally Ray, our keynote for this morning. Sally, thank you so much for being with us today.
Hello, and thank you, Amy. Thank you all for including me. I'm thrilled to be here. As Amy said, I'm Sally Ray. My pronouns are she, her, hers. I'm going to share my screen here quickly and begin a slideshow. So hopefully you can see that. As I said, my pronouns are she, her, hers, and I am coming to you from beautiful Cypress, Texas, just outside Houston, where it's supposed to be a balmy 98 degrees today and will feel like 106. So here's hoping my electricity stays on for this entire presentation today. I am going to start at CDP. We begin all of our events with a land acknowledgement. So I'd like to start there. We acknowledge that we are working from the stolen lands of the many original peoples. We recognize that Indigenous peoples have been displaced and disenfranchised from their land by the socioeconomic and cultural disaster of colonialism, as well as disasters. We acknowledge that when the U.S. was founded, there were exclusions and erasures of Indigenous knowledge about how to appropriately care for these lands, causing environmental destruction and degradation, which has had a significant impact on disaster risk and on communities. We are committed to dismantling the ongoing practices, systems, and structures of settler colonialism and white supremacy. We commit ourselves to understanding where and how wealth accumulation has harmed people and Mother Earth herself, the earth itself, and the complexities of philanthropy as connected to that truth. Despite centuries of theft, violence, and murder, this is still and always will be Indigenous land. Please join us and acknowledge the original peoples and their elders, past and present, as well as future generations. Now let's dive in. Honestly, I feel a little bit like I'm preaching to the choir here. However, I'm hoping that today will benefit from this discussion. Here are some of the outcomes I'd like for us to get to with this session. I want us to have a better understanding of mental health, grief, and bereavement resources that are available before, during, and after disasters. I hope that we'll all know the roles of different actors in supporting community recovery and the importance of addressing the trauma caused by disasters. I'll provide some recommendations for government, non-government organizations, and philanthropy on how best to address community mental health needs in disasters. And I'll share some examples of how philanthropy has supported community recovery from the trauma of disasters during funding of mental health, grief, and bereavement projects. In case some of you aren't familiar with the Center for Disaster Philanthropy, I'm going to start with a little bit of an overview of who and what we are and how we work in this space. First of all, our mission is to leverage the power of philanthropy to mobilize a full range. I'm going to start over. Our mission is to leverage the power of philanthropy to mobilize a full range of resources that strengthen the ability of communities to withstand disasters and recover equitably when they occur. And our vision is a world where the impact of disasters is minimized by thoughtful, equitable, and responsible recovery for all. I emphasize equity and for all here, as that is the most significant element of our vision. We do our work in 3 buckets. I say buckets, but Some of my colleagues call them pillars or legs of a stool or some other similar item. Buckets works for me because I see that my work flows from bucket to bucket and then back again. At CDP, we provide educational resources, mostly directed at the philanthropic sector, but they're also useful for anyone interested in strategic investment in disaster recovery and resilience. This includes blog posts, white papers, research and data consolidation, toolkits, and more. The bucket where I do most of my work is the grant making and recovery funds one. But like I said, I flow from bucket to bucket. We have multiple pooled funds which we deploy in support of grantee partners like Vibrant across the globe. I oversee grant making for the domestic side, and I have a counterpart at CDP who works on our international side. We have funds that address specific disasters and geographies and others that help us deploy funds for any disaster that might occur. Finally, CDP has a strong consulting bucket of work. We support corporations, foundations, corporate foundations, community foundations, and occasionally high net worth individuals to develop their own strategic goals for disaster philanthropy. We offer expert resources as well. All of this information is available on our website at disasterphilanthropy.org, our disaster philanthropy playbook, disaster issue insights, disaster profiles, weekly updates on disasters, webinars, special statistical reports on the state of disaster philanthropy and philanthropic giving for COVID-19. In addition, we have many disaster and crises subject matter experts on our team that do things like what I'm doing here today, and so much more. Now let's dig in a little bit into today's topic. The resource I used most as I've prepared this presentation is one we created with support from the New York Life Foundation, a consulting project that was led by my colleagues. This work resulted in issue insights into mental health needs and access during disasters, as well as a complete toolkit for philanthropy to use when determining ways to support recovery from the trauma that's caused by disasters. I must give credit and a loud shout out to my amazing friend Kim Maphis Early for providing me with much of this information with her amazing work for the New York Life Foundation. I am a huge Kim Maphis Early fan, and if you ever have an opportunity to hear her speak or see her work, please definitely dive in. I bet we've all seen this graph before, but it comes from the Substance Abuse and Mental Health Services Administration of the U.S. government, or SAMHSA, as we all lovingly know it. This is a visual representation of the community emotions that occur after a disaster. It's important to note the lows here and where they occur, up to a year after the event, and when most government funding for any mental health support has run out. We at CDP have always known that individuals and community mental health suffers because of disasters. It's always an issue we know we want to try to address as we support recovery from any disaster. The stress of living through a crisis and its aftermath exacerbates prior inequities and creates new ones. This has been totally laid bare during the COVID pandemic and the layered traumas that have occurred in our COVID world. Underlying inequities like substandard housing or lack of access to affordable housing, lack of food security, limited access to or no access to healthcare, proximity to a hazard, they're all enhanced, exacerbated during and after a disaster. The intersection of mental health and disasters is one of the more culturally sensitive aspects of response and recovery work, and unfortunately, also one of the least funded among philanthropic disaster investments. This is why we condone a holistic approach to recovery, addressing all these needs and for the long term. We also focus our funding and our work at addressing the needs of marginalized populations. We know that too often following a disaster, the wealth gap widens as those who have get more and those who have not often lose what little they have. We focus on the elderly, school children, Black, Indigenous, and people of color communities, those with disabilities and chronic illness, single parent households, women, those living in poverty, immigrants and refugees, and of course, our first responders and emergency personnel. We as funders must consider the pre-existing inequalities to help direct our resources, both human and financial, appropriately. Survivors are diverse and have varied approaches to mental health assessment and interventions. Our programs and projects must incorporate culturally appropriate interventions. And needs are different for a single traumatic event and versus communities that suffer from repeated disasters or chronic ecological or environmental stresses. And of course, if a community does not have access to quality services like medical care, insurance, or any of the other social determinants of health, then suffering will be compounded and extended. I may sound a little bit like a Sallyanna, as I like to call myself when I say this, but let's address these inequities in blue sky days and improve a community's capacity for response and recovery before recovery is needed. Again, preaching to the choir here, I know. However, these are signs of concern we often see in individuals affected by disaster, crises, or layered traumas. Eating or sleeping too much or too little, isolation, pulling away from things you love, like people or activities, having low or no energy, being tired all the time, unexplained aches and pains, feelings of helplessness or hopelessness, worrying a lot of the time and or having feelings of guilt, thinking of hurting oneself or someone else, and having difficulty readjusting to home or work life or dealing with whatever is now one's new normal after a disaster. So now let's dive in take a little bit of a very high level view, panoramic view of the different roles sectors play in responding to mental health, grief, and bereavement following a disaster in a community. Local, state, and federal governments play an early but limited role for grief and bereavement after a crisis domestically. First of all, they're usually responsible for controlling access to a devastated area, only allowing those that they deem have appropriate credentials to enter into a disaster zone or to interact with survivors. The more formal role that FEMA plays is with its Crisis Counseling Assistance and Training Program, or CCP. This program funds mental health assistance and training in areas with a major disaster declaration. So smaller, undeclared, and low attention events do not receive the support. If the disaster is federally declared, there are two programs available. The one does not automatically mean that you get both. The Immediate Services Program, or ISP, is for the early stages. The Regular Services Program, or RSP, is an extended program. However, both of these are limited and only provide crisis counseling for a rather short period of time, up to 1 year max. And this is disaster crisis counseling, not long-term mental health treatment and care, which is often much more critically needed and for a much longer period of time. The role of NGOs then is critical. This is where most of the mental health, grief, and bereavement support happens. There are several organizations that can be supportive here, including the Crisis Emotional Care Team, national, international, local, professional organizations, professional associations, faith-based organizations, local churches, other local community organizations. Support is varied, and all of it is critical and important. Many organizations provide direct assistance with counseling, psychological, and psychiatric care at low or no cost after a disaster. It is critical, however, that this be carefully and locally coordinated so that support is provided equitably. That's the key. So what role can philanthropy play? We know that government funds are limited and, more importantly, time limited. They usually dry up within 1 year. And if we think back to the SAMHSA chart I showed earlier, most of the trauma-induced behavioral health issues show up at the 1 year mark or even later and can manifest for years after. Philanthropy provides the only formalized funding mechanism for mental health services other than what limited access is provided by an individual's insurance. Funding from philanthropy can include provision of counseling services, awareness and educational campaigns that are mainstream, culturally and racially diverse and honor traditions, utilizing traditional and social media platforms to increase reach. Philanthropy can and does fund important access and information about that access. Again, funding should be carefully and locally coordinated so that support is provided equitably for the whole of community recovery. Unfortunately, philanthropy has failed to adequately step up. There's significant room for growth and opportunity. With our partners at Candid, CDP has been able to track philanthropic grants from 2012 to 2019 for mental health services following a disaster. When you consider that this covers 7 years in which we saw Superstorm Sandy, the Ebola crisis, and a series of major hurricanes that include Harvey, Irma, Maria, Dorian, Florence, Michael, that all hit the US, the numbers look tragically small, particularly when compared to other facets of recovery. These numbers would be even smaller if we looked at grief and bereavement as separate components. I'll share some of the ways, the great ways that philanthropy is supporting this work a bit later, but it is still woefully falling short of the need. How can we improve mental health, grief, and bereavement support? What can we do? So here are some recommendations for government engagement. We're seeing some significant movement toward this with our government partners, but there's still a lot of room for growth here. Our governments should have a big welcoming table and keep that table wide and open. FEMA is already recognizing the need to make changes in some of its processes and moving at the snail's pace that government policy change typically does, but they're trying to address some of the inequities that are exacerbated by disasters. Our hope is they'll continue making progress here. Local governments should be advocates for their residents, advocate for those who need the support. Communities need to determine before a disaster which indicators suggest gaps in support within the mental health system in that community and address them before a disaster hits. Though we knew there were problems before, COVID has again laid bare many of the inadequacies of our health and mental health care systems. Even with insurance, accessing mental health services is difficult and seems to be getting worse, not better. So government needs to foster collaborative, comprehensive approaches to pre- and post-disaster preparedness and response. Convene community gatherings that foster social cohesion, reduce isolation, and recognize the shared experiences of community members, both pre- and post-disaster, hopefully vaxxed and masked, of course, these days, or at least socially distanced. And make sure the entire community is included. And finally, and critically, check laws and make changes where needed. Often state or local health departments have laws that restrict or prevent addressing mental health needs in a timely fashion. For instance, can persons who have prescriptions get vacation overrides and receive additional refills of their medications leading up to a disaster or immediately following when they may be in transition to shelter or temporary housing? Do differing counties and municipalities or the state have specific laws that allow for licensed professionals to receive temporary licensing to practice in your locality in the case of a disaster, allowing volunteers from out of state to help address increasing need? Check those laws, make those changes if you need to. What improvements can non-profit organizations or non-governmental organizations make? Examine cultural barriers to voicing mental health needs. What languages are spoken in your community? Have access to information in those languages. Who are the most marginalized? Access those populations early before a disaster happens. Promote honesty about mental health needs and advocate for support through public storytelling. Sell your message here. Build internal and community capacity. Develop a flexible and trusted referral network. One organization can't be all things to all people, so know who's doing what and be comfortable sharing with them. Keep track of inquiries and provision of services so that you can more accurately tell the story of your work and of the needs in your community. Offer long-term psychological counseling and case management or navigation to disaster survivors. The trauma doesn't end at the 1-year mark. And of course, CDP has recommendations for improvement in the philanthropic sector too. Be ready in advance to support organizations after a disaster occurs. Be ready in advance. Have relationships ahead of time. Know who does what and how you can best help them. support research, analysis, and education on health issues and mental health concerns post-disaster. Fund advocacy. Fund advocating for your community. Fund crisis support counselors in non-traditional settings, schools, community centers, churches. These organizations can often reach people where they are and without the stigma that comes often with seeking help. Be on the lookout for populations that may have high need but little attention or response infrastructure. We spoke about some of these populations earlier. Focus on those. Mainly, be a good and patient listener to those in your community and your nonprofit partners. Think local whenever possible. Be flexible and reward innovation. Fund capacity. Fund pilots. Fund grassroots. Be ready for the long haul and for the complexity of a long-term recovery process. Partner with other funders and collaborate with nonprofit partners. Co-fund. I do this a lot. You don't always have to be, and honestly shouldn't be, the only funder of a project. Help your nonprofit partners access your network and expand their reach. There is some good news about what philanthropy and non-partners are doing. So let's share some of that good news. It is getting better, and we are seeing our message take hold a little bit. I'm going to toot the horn of some of our CDP grantee partners here. Through our COVID-19 Response Fund, one of the primary issues we focused on, both domestically and internationally, is supporting mental health recovery from the effects of the pandemic. We funded the National Alliance on Mental Health Illness, NAMI, to ensure access to timely, practical mental health information and to bolster the capacity of NAMI's helpline. We also helped fortify their network of NAMI affiliates and NAMI state organization. That's our local piece. We helped build capacity. I stand on that soapbox frequently. Lots of people hear me talk about it. Catholic Charities USA used our funding to focus on serving the most marginalized, especially the elderly, unemployed, and children and youth. They provide holistic case management to ensure their clients are connected to the resources and support they require both immediately and long-term. This includes mental health support services. They had relationships with fellow NGOs for appropriate referral and well-trained disaster case managers to know when mental health needs should be addressed. And of course, we funded the Crisis Emotional Care Team at Vibrant Emotional Health twice now to expand the number of volunteer mental health professionals available to provide services during the pandemic and to offer disaster mental health training to licensed mental health professionals on an ongoing and just-in-time basis. And we've just recently approved a new grant from several of our funding streams for the Crisis Emotional Care Team to expand their offering of psychological first aid training and other disaster first just-in-time trainings to organizations that are working on the front lines in multiple locations on disaster recovery. Again, we're funding capacity. There I am on that soapbox. Some of our funding we've done in other disasters includes support for Mental Health America of Greater Houston as the lead agency establishing the Dickinson, Texas Mental Health Project in their schools following Hurricane Harvey. We provided mental health services to students, to teachers, to faculty, to staff, and to families. It was a huge collaboration among multiple NGOs and funders, and Dickinson was dramatically affected by Harvey. It wiped out a big section of their public housing and other things that, and other low-income housing, plus it affected the entire community. We also funded MHA of Houston to support training nonprofit repair and rebuild organizations on how to identify clients who were showing hoarding tendencies and to provide those clients with access to mental health services to help them through that process. Both of these projects were pilots. We funded capacity, they were collaborative, and we co-funded. So all of those messages, we walk our talk at CDP. We helped Texas Children's Hospital expand their mobile mental health care units, which allow them to increase access to the care and provide appropriate referrals for additional services to children and families in some of the most affected and marginalized neighborhoods after Harvey. These kids were traumatized, and Texas Children's brought help to them in their neighborhoods, community centers, and schools. In this case, we were funding local and we were funding capacity and expansion and access. Through our California Wildfires Recovery Fund, we helped La Familia Sana, a very local grassroots organization in Sonoma County, to provide group and individual mental health counseling services to members of the Latino community that was significantly devastated by the loss of income due to the wildfires and the cascading layered traumas of the pandemic and stress, depression, and anxiety. The services they provided were culturally appropriate and often utilized story circles to help eliminate the stigma of seeking services. Other funders are doing great work as well, especially as we see the needs getting more attention and airplay. COVID has laid it bare, like I said, so we're beginning to see an increase in attention in this area. I already mentioned that the New York Life Foundation supported the development of our mental health, grief, and bereavement and disasters toolkit. They've also invested in numerous other organizations addressing these issues in innovative and creative ways. And we know of so many other local and national funders who are also doing their part. Here are just a few of the organizations they've all supported, all with creative ways of reaching the communities where they're needed, how they're needed, and with long-term support. So I'm kind of moved through this quickly, but I think we have a few key takeaways that for us to remember from my conversation here today. First of all, mental health, grief, and bereavement are underfunded, and yet are some of the most critically needed services for full and healthy recovery from disasters. Philanthropy can and should, and dare I say must, have a tremendous long-term impact in this space. It is the only formalized funding mechanism for mental health services after federal funds and programs close outside of an individual's insurance coverage. Long-term funding for mental health services and counseling program is vitally important. Education and awareness campaigns can help encourage participation, and I'll add, advocating for more services is key. Let's use the awareness of need created by the pandemic to secure more attention and support. Media messaging that is appropriate and tailored to specific populations is so important. People need to know what's available so they can seek the help they need in a comfortable and inviting way. The launch of 988 is an opportunity for all of us. Let's get the message out in a culturally appropriate way for all populations so they know and understand the significant opportunity here for accessing help. Finally, here's a list, and in my slides, they are links. Here's a list of some available resources should you want to dive deeper. All of this can be found in the disaster toolkit on mental health, grief, and bereavement in disasters that we have available, and that is free and accessible on our website at disasterphilanthropy.org. Now, I moved a little quicker than I thought I would. So I think we have a little time, and I'd be happy to entertain questions if that's appropriate. I may not have the answers, but someone else here might. Thank you so much for including me. I'm grateful for our partnership with Vibrant and for everyone who was able to join today. So if you have questions, please do that and I'll stop sharing my screen.
Thank you, Sally. Really appreciate your presentation today. But just loved if I can ask a couple of questions for our conversation. So in some of your reviews of different programs that are, initiating training and, building capacity to kind of reach those individuals who are marginalized in the faces of disaster, what are some of the key markers that you as a funder look for when determining, or predicting as much as you can whether or not a program is going to be successful, specifically in this niche? Like, are there a couple of markers or just points of consideration that people can consider when developing programs?
Well, there's an awful lot of research out there,
Mm-hmm.
and I think basing it on data and experience. I also think one of the markers I look for is, do they know their community? Do they know who they're trying to help here? And have they done their research? So, certainly we have relationships with large organizations, national organizations, international organizations. We have those relationships in advance. But when it comes to the more local ones, the ones that we don't perhaps have a relationship with, I look to understand what's their expertise. What history do they have? Do they know their community? Are they engaged in that community? Have they used data that's available to identify what the needs are? And I have really, honestly, I have a one-on-one conversation. Amy, you're familiar with this. We get on Zoom. Before COVID, we called it shoe leather philanthropy. We go in and we meet with them and we fully understand what needs they've identified and how they plan to address them. So, those are markers. Are they engaged in that local community? Do they know that community? And are they using data to support their programming?
That's a great question. So April actually posted one that I'd love to ask too. So more from a general perspective, I guess, could you talk a little bit about how the team developed CDP? You guys are very unique in the space and specific to this work. Would love to hear a little bit more about that background, if you don't mind.
Sure, absolutely. We started about 12 years ago, and we were started by philanthropy. So they were actually corporations and foundations that had identified that this was a significant need, that a lot of donors, philanthropy was, we've all experienced it in a disaster. Immediate response and relief gets funded very quickly, and the dollars come flowing in, and sometimes to the detriment of a long-term recovery process. Right. And so several funders came together and said, we need to be more strategic and thoughtful about that. So let's create this organization that's going to help us learn and understand and then communicate and share ideas and thoughts with the philanthropic community. So we started with that as our focus. And as we began to develop our expertise and brought in subject matter experts, some of our corporate partners said, hey, you know what, you guys get this, this, let's pool our funds and let you be grant makers for us. So we continue to learn, we continue to do research and advocacy and all sorts of things like that. So and we've built our team. When I first joined after Hurricane Harvey, I think we had a team of 6, and we're up to more than 20 now. So we've grown significantly and built our base of knowledge, and certainly have an amazing team of experts that are helping us build this niche for us.
That's great. Okay, so the next question came from Maggie Jerry from SAMHSA. Can you share examples of effective inclusion of philanthropic partners as a part of coordinated response and recovery efforts? And then secondly, do you have specific ideas of ways that government agencies could better engage in communications with philanthropic organizations as a part of public-private partnerships?
Yeah, absolutely. I think we do an awful lot of work with long-term recovery groups and making sure that the government agencies are engaged in that process at the local level, I think is pretty important. I know FEMA engages there. So any other agency that could engage with that group, it usually includes our mental health serving social services organizations are participating in that. Even sometimes, ones you don't think about as disaster responders. So I think it's important that government agencies be at that table, for sure. And FEMA, we know, already usually has a philanthropic liaison of some sort that's engaged there, and I know those people, and I engage with those people, and I communicate very closely with FEMA VALs as well. So and we're always open. I know we are always open to meeting with and discussing ways with our government partners that we can be more supportive of one another and work together to be collaborative. So that does happen quite a bit, actually. Like I know most of the VALs working in most of the space, and I do know most of the philanthropic liaisons as well. And I think, but more importantly, we also come to know the emergency managers at that local level. Sure. I talked just for a second about our shoe leather philanthropy. I live in Texas. For the Hurricane Harvey Fund, I went to every single county that was affected. I actually went there and met with local government leaders, with community leaders, with the long-term recovery groups, and with all of the responding organizations, because I needed to understand exactly what the needs were. I don't get to do that as much with COVID, and now that I cover, the entire US, it's a little harder. Yeah. But I call it Zoom leather philanthropy, and getting to know those people. So we are always open to meeting with our friends and advocating for our friends in government, advocating for ways that we can partner together. I think I think it's critical. I love that somebody from SAMHSA asked that question because that shows to me that you're open and ready to have conversations on how philanthropy can support or take over or manage that process for the long term. So we're open, and I'm glad to see that our government partners are open as well.
There's a question in the question box that says, what gaps still exist in being able to scale a trauma recovery response to meet the needs of a population that needs these resources? What current gaps exist?
Well, I think it's just that pre-understanding of who those folks are. Some larger communities, even some smaller communities, do community assessments in Blue Sky Days. And those are, identifying the assets and, where they need to build assets.
Yes.
And I think gaps in funding for that sort of thing, or gaps in understanding for that sort of thing is pretty significant. So I do encourage local funders in particular to fund that sort of asset assessment. So that's a gap to me, understanding the local community and having access to them. I've been spending an awful lot of time lately, because we have the Colorado Wildfires Recovery Fund, meeting with community leaders in Boulder after the wildfires that hit there, understanding who's in your community and who's going to need the help, and making sure that everybody is getting that help is pretty critical. And just because they're louder voices doesn't mean those are always the voices that you need to be listening to, that there are other quieter voices that you need to know. So there's gaps in making sure that we equitably reach the people who really need the help, and that we reach everyone and not just those loudest voices.
So as a follow-up to that, I was just, I'd love to your thoughts on maybe some questions that providers can ask to ensure that they are meeting those needs. Because I feel like, I mean, anecdotally, I've heard enough of times where people, the intention is there to ensure that everybody is included in the solution, or that, these individuals who are often, just due to the systems or organization, are left aside. What are some questions that providers can ask to just of themselves or of the community to ensure that all are considered? And
right. I mean, I think understanding language barriers, cultural barriers, asking those questions, making sure that you're engaging with the organizations that are interacting with that part of the community, and that you understand the cultural barriers that might exist there. Asking those questions in advance, or even, in a disaster, it's okay to continue to ask those questions. One of the things we discovered in my colleague, Carrie Cullen, who oversees our Midwest Early Recovery Fund, was so creative in her funding through the COVID, through the pandemic. She actually funded, navigators in community who spoke specific languages of organizations, of communities that they knew were there. So, not just Spanish, but, other languages that were needed. And just having access to somebody who spoke the language opened doors for them and for the services, and being able to reach those pieces in the community. I mentioned it earlier, providing the information that you're sharing in an appropriate language or on appropriate media channels to make sure that everyone gets that information. So just asking the questions, what are we doing? How can we break down those barriers? Go to trusted grassroots local organizations that are working there. Maybe it's a church, maybe it's a community or a neighborhood community association. Maybe it's, just a couple of grassroots community leaders that are trying to serve their community. Go to them and say, how can we culturally appropriately reach this community, and can you help us do that?
Yeah, no, that's great. I think I'd also, again, I'd love to hear from your perspective, in your Zoom leather outreach, how your partners are doing. Because I think, any organization that is active in providing support in disaster, especially in these last 2 years with all of the complications and nuances, what's the pulse check on your recipients? How is the staff? What are maybe some challenges that they're facing that are perhaps not impeding the work, but making the work a bit more complex, I guess.
Well, Amy, we reached out to you
Yeah.
with that question. How can we help those who are doing the work on the front lines? How can we make sure that they are first taking care of themselves, but then have the tools they need to help take care of their communities? So it's a struggle. I mean, and that's why I think it's critical that philanthropy become involved. We have to support that. We have to support the care and tender situation that our frontline workers are engaged in. I didn't mention it, but we also funded the American Nurses Association to be able to provide some of these self-care opportunities for our frontline first responder nurses, right? That's critical that they have tools to care for themselves. And we know that particularly in layered trauma, when people respond to disaster after disaster after disaster, they themselves become, affected by that trauma, and it's hard to deal with. I'm grateful to work for CDP because they recognize the need for our self-care and provide us opportunities for that. Mental health awareness month last month, we all received an opportunity. Go do what makes you feel good and send us the receipt and we'll help pay for that. So it could have been a massage or a pedicure, or for me it was spending time at the lake. And so we got to submit that, providing opportunities for your frontline people for the layered traumas they're experiencing and responding in community. We're still in a pandemic, and in a pandemic, we're having tornadoes and wildfires and hurricanes. And when you layer all of that on top of each other, and the people who are responsible for responding in community have to do it time after time after time, we need to make sure they're taking care of themselves as well. And that's critical. And so I'm so grateful for you and for your crisis emergency, emotional care team. Sorry, I need to know what you are, for the work that you're doing with our on the ground organizations.
Thank you. And so actually we just, Dr. Natural and I were actually just in Nashville, working with Hands On Nashville, who I know your team is familiar with. And in our conversation about navigating leadership dynamics in between everyday and disaster, you spoke a little bit about preparing, right? People needing to be prepared. And one of the kind of things we've noticed in the journey that we've been on is that there's a sense of heightened purpose when disaster happens. And then when it, perhaps winds down or there's some debriefing that closes it off, people are often left kind of just a little bit lost in kind of knowing what to do next, because there was such a heightened kind of adrenaline rush in the moment, and then now back to every day. And one of the questions that came up, and I'm curious for your input, is what can, just a team that is a community organization that has everyday operation, but then also is called in by local agencies to be a provider in disasters. What are some steps that they can take, or that you've seen maybe a really strong organization takes to ensure that their team is prepared for that shift in between whatever happens every day to the intensity?
I'm going to own that I probably don't have the answer to that one.
Okay.
I would rely on the experts, as
Sure.
experts, to help them make that transition. I certainly have seen it, and I've experienced it. I'm as my work with Harvey began to wind down, it became kind of a joke at CDP. Let's find, let's make Sally relevant. So what? And golly gee, here I am relevant. So there's never an end to the disaster cycle, right? But I understand that. So I think having those conversations is critical, and having resources like what you're providing for these organizations is critical as well, to help them make that transition and understand the importance of their role, and also to help them understand that, okay, this one's over, but there's bound to be another one. So let's kind of, in our transition, let's take our learnings and begin to apply them and prepare for the next one and be better for the next one.
And I think my final question before we move into the next panel is, what are, if you can, share some of the behind the curtains conversations that your team is having as we look like we're in the midst of this very intense moment, I think, in our country, and a lot of discussion about gun control, a lot of conversations about the involvement of ICE specifically in the Texas shooting. What kind of conversations is your team having about providing support in that kind of in the human caused crisis and in situations of mass violence, if you wouldn't mind?
Yeah, no, we certainly recognize that that's a disaster, right? CDP focuses its efforts on hazards, natural hazards, typically, and has really not engaged in responding to with philanthropic resources in man-made disasters like that.
Sure.
It's although, you know, one could argue all of our disasters are man-made,
Sure, yeah, no,
right?
right,
in one
right.
way or another, or at least, you know, they're intensified because of the human element. So we see that those are disasters and that communities recover in a similar way from something like that. And we certainly provide resources as much as we can with information and insights and things like that. But we have chosen not to engage in, you know, violent man-made incidences. It's not our area of expertise. We feel more comfortable and have a better understanding, and that's our niche. Our niche is on that. But we do also understand that there's an intersection. For instance, with COVID, with the George Floyd murder and all of the protests and activity and energy around social justice, we recognize that it intersected with the COVID pandemic and other disasters, and so recognize the need to particularly focus resources in community to address some of the social justice issues that we recognize were going on there. So it's not that we aren't engaged or we don't understand the intersectionality of disaster and trauma on those communities. It's just that specifically is not where we have expertise.
Well, and I actually want to honor that too, because I think this comes up a lot as well in some of the conversations we have with local organizations, where there's a sense there. I think the temptation, right, is to engage whenever kind of that, again, that heightened sense of need arises. But really, we just actually, again, had this conversation on Monday, but knowing what those boundaries are, and strategically placing them so that you can be excellent and profound in the impact that you have, and providing insight and having conversations, but just knowing when to kind of deploy the team versus provide advice or counsel or a connection to other resources that might be more effective in a particular area.
Yeah,
so,
I live in Texas, so
yeah,
I'm paying attention to the response there, and I certainly know who's engaging and what's going on, and I share what I know with my colleagues, so that if they have questions from other people, you know, about what's going on, they understand that as well. So you know, it's not that we don't personally engage, it's just it's not a space for CDP. But yeah, I mean, they are part of the conversation.
thank you.
Always.